Welcome back. I hope that everyone is having a good summer and that people are traveling safely to and from intensives. There truly is no other word to describe that experience besides intense. So I just returned myself. I apologize for getting this video out late on a Monday. I did want to start giving you all some guidance in working through Module 9 and Module 10. So let's go ahead and jump in. Let me go ahead and share my screen and see what we can do. So I want to bring your attention to the practice components again. So really our first module there, Module 8 on TFCBT, really covered the first two P's, PPR, relaxation. Now we're going into the AC. So Module 9 will really cover affective expression and modulation and cognitive coping and processing. Now I really want to separate and I want to really instill a large sense that you can do this with anyone. So you can really do the PPRAC with any client. You're fine. Now, that said, if you're going to continue on, Module 10 goes into the trauma narrative. Research indicates you don't want to, we focused on that diagnosis question back in Module 5. You don't want to diagnose or treat trauma if it's not there. You don't want to project dysfunction where it doesn't exist. So I talked about, making sure that you had that good assessment before you, have someone talk about a trauma narrative. We're going to cover some really sensitive stuff in Module 10, and I want to give people a realistic glimpse of what it's like to work through a trauma narrative. It's not for the faint of heart. But before we get there, let's go over the AC of the PRAC, PRAC. So if I'm talking about affective expression and modulation, really what I'm trying to discuss here are trying to help children and adolescents label and fully express emotions. That's a large part of child counseling anyway, because they have a limited vocabulary, and traditionally you have three emotions: happy, mad, and sad, right? So hopefully we give them a bigger vocabulary, a bigger emotional range of expression. So, you want to correctly identify and label a range of positive and negative emotions. Accept all feelings as a normal part of life. And understand the causes and consequences of emotion. That goes into the cognitive coping part of it a little bit. But how a range of negative emotions get expressed as anger. So again, if you have stuff on anger as an iceberg, you're only seeing the tip of the iceberg. When somebody's mad, there's just a conglomeration of feelings that generally underlie anger. And if you ask me, at the root of that is fear. Learning and practicing appropriate ways to express a range of feelings. Really the big thing that you want, and learn self-soothing, a lot of good things using positive self-talk, thought stopping, positive imagery. The big thing that I want folks to get from this is, there's a lot of goals there, but really I'd like you to get the understanding of using that feelings thermometer. So for young kids that don't scale numbers well, 1 through 10, and really we don't use the thermometer that you stick under your tongue too much, anymore, and it's got the mercury that, rises. But that's kind of the idea, is that, the hotter or the more intense an emotion, the higher the number, the higher the level, and the less intense an emotion, the lower. So not only do children and adolescents identify emotions, they also identify a level of emotion. Now, why that's important is, and this will go to the discussion board, why that's important is when you're working with a child, when you're working through a trauma narrative later on, it's important just in life too, but it's important to kind of get a sense of where that person is as they're working through their trauma. As you know, one symptom of PTSD is re-experiencing and reliving. And if a person is working through, or a child is working through a traumatic memory, and they're decompensating, and they're in the exact place and feeling where it happened, that's too much. They're feeling it, very likely a 10, a 9, or a 10. And if they get there in the session, that's okay, honestly. But you need to be able to work through and practice bringing the child, and the child also needs to work through and practice bringing themselves down. So in affect modulation here, affect expression and modulation, it's learning about identifying and recognizing when those feelings are very acute, and taking some deep breaths, some lemon squeezers, progressive muscle relaxation techniques to bring themselves back down. Now, you do want to take them, and it is necessary to have some sort of connection with the emotion. I found a really an amazing quote that helped me understand this a few years ago, and I've got my big file of training that I've done on trauma, and my big trauma-informed folder. I've been going back through, and it's been good for me, because I forgot a really, and I'll try to share it rather than just show it on the screen. But one of the trainers that I spoke to or learned from said that neurons that wire together also fire together. Meaning, if you were in a sort of situation where the trauma involved a really trusted caregiver, those neurons, those painful neurons, when somebody gets close in a relationship, when that comes up later in childhood or adolescence or life, what's going to happen when that person starts to get close to a person, starts to really love someone again? Those same neurons are going to fire. They're wired together. That memory wires them together. If it has to do with sexual abuse, what's going to happen later in life when somebody tries to have a sexual relationship, when as a child they experience this trauma, think about the feelings that are wired in there too, the feelings of shame, the feelings of the feelings of fear, the feelings of being out of control, the feelings, all, there's just so many feelings that underlie. And again, this is where we're at with these affective expression. Being able to control those, being able to exert control over those emotions, and then be able to go through and rewire through the narrative. So this is really an important aspect of the narrative. So we'll come back to that in just a second. I'll show you some resources. Let's move on to cognitive coping. So cognitive coping, and this is really tough for younger kids. I would say you really need to be on a concrete operational, if you think of Piaget, think of 7, 8 to 12 at least, before you can start really thinking about this cognitive coping and processing. You can maybe start to get there with the little younger kids, but if there's some delays in there, this cognitive triangle thing is going to be an elusive concept. Although you can start, you're going to have to be really visual, really tactile, extrasensory. You're going to have to use a lot of, get up and move type of things. I remember my advanced training, they actually had, a picture of a brain and a picture of a heart for feelings, and a picture of a body, for actions. And they put them in different areas of the room. They put a big picture, and then so they'd ask the child, okay, so walk to it. Which one of those describes anger, or the fear? And so they would walk over to, the heart, and let's say that you have, a thought about the, abuser, and so they'd walk them over to the brain, and so what do you do, and so normally you think, feel, do, TFD, but I'm walking through that backwards. But then the child might cry, the child might hit, or the child might go hide, and it helps them kind of connect the dots there between thoughts, feelings, and behavior. That's really basic, cognitive behavioral therapy. You get in the cognitive triangle. I've got a handout that I'm going to share with you. So again, this is where you kind of start to challenge negative thoughts, use mindfulness. Let's get into your resources before I take too much of your time. So let's move in over here. This is Module 9, and let's just see what the resources are to help you through this week. So I do have some reading materials for you in Module 9. The primary thing I'd like you to focus on is this article. It's written by Cohen et al., a lot of the authors of TFCBT, and read page 1 through 11. And there's quite a bit of reading. It's pretty dense, but it gives you some case studies, and it'll help you visualize what they had in mind when they put together the TFCBT model. It's really supposed to be a comprehensive approach to treating trauma in kids. So please read through that. Here's the auxiliary folder. I have a lot of resources for you in the auxiliary folder. So here are some feeling thermometers. So for instance, if you have a child, you might, and I used to do this, I just check in with a child when they come to me in therapy, and I'd say, think about today, think about, depending on their age, and think about today, and think about these 5, and I just start with 5. Well, if the older the child, the more emotions that you can add, and the more, sophisticated they become in their understanding of feelings. Think about being angry, think about being sad, scared, worried. So we can feel a lot of things at once. So, might even just take one situation, and start with something besides the trauma. Start with something low, because this is a systematic desensitization. So as you work through, you start to bring more and more aspects of the trauma. So tell me, when you were at lunch today, how did you feel? And so they might, understand, well, I was a little bit angry. I wasn't sad. I was pretty scared. I didn't know if this bully was going to take my lunch money. I'm making that up, obviously. I was pretty worried. I don't know who to sit by at lunch, and feeling mixed up. That was pretty low. So again, they can rate those emotions over, and again, they color them in like the mercury's rising in a thermometer. So you can add these. You can obviously change this up. You don't have to use these 5 or these 7 or 8 emotions here. Let me move back the contents here. So you can draw your own. You can draw them on a whiteboard. I used to do that quite a bit. Let's see here, cognitive triangle worksheet. I gave you a lot of resources here. And this is just some of the wealth of information that they provide you when you go to the training. So this is a 42-page, and you don't have to, obviously respond to all this. This is just something for you to have as a part of this class. It just kind of gives you ideas, a few tools to kind of work through. And obviously, if you're reading something to somebody, it's not going to come across as genuine or authentic. But, you can take these kind of ideas. These are things that are actually, handed out in a TFCBT training. There's over 100, literally, it seems like thousands of pages, but there's way over 100 of these type of resources that you receive through the training. So again, it goes through a lot of cognitive behavioral stuff, cognitive distortions. Hopefully there'll be a range of information there for different children, different age and ability levels. Let me go back here again. Rate feelings. This is just part of the A, the A of the AC. So again, it puts it like a 100-point scale. You can do it many different ways. You don't have to use the thermometer. I usually, for people that are really quite verbal and understand like scaling, on a scale of 1 to 10. And you might also do that with children, because when you get into a narrative, and let's say they start talking about some really painful situations, and you watch their affect change, watch their presentation change, just check in with them. Where are you, on a 10-point scale? They'll say, I'm at a 9. And also, I forgot to mention this, before you go into the narrative, you agree with the child to have about a 7 or an 8. You want to get them up to a 7. They need to feel something when they're giving the narrative, or you're not going to rewire. You're not going to rewire with the feelings of safety. But if they get up to a 9 or 10, that's where we're going to bring you down. I don't want you to feel that badly, okay? And just agree there's a safe spot, okay? That's something really important to work through with the child if you're going to move into the narrative, which we'll talk about. Lastly, let me talk about the cognitive. And I was going to have you do this as an activity. It changed my mind just because there's so much going on. I know that there's a lot happening with intensives, and just really, really a busy time of year. So here's a cognitive triangle worksheet. It's completely open. So, you know, that this is really RABT. If you think Ellis, you know, the activating event, the belief, you know, it leads into, well, you know, you think of A, B, C, D, E, F, activating event. I'll have to go back and review. My mind, I've traveled for a long time and my mind is not there. So I apologize for scrambling up Ellis. But, you know, you've got your thinking, your feeling, you're doing the event, and you can walk through. There's some spaces. And there's another way of looking at it too. And I really like that they add extra lines, because honestly, we're not just usually thinking about one thing when something happens. We should have several thoughts, several feelings, and maybe even several behaviors. So, you know, this is some blank lines. This comes directly from the training. This is basically the same thing in a different format. In fact, it is the same thing. It appears to be a duplicate. That's okay. Okay. And so you have some resources there. Please, let's look at the Module 9 activity I've taken out. We have too many things going on here with intensives. And I think I'm actually going to spread TFCBT into one more module. I might modify the schedule here. So here's your discussion. You know, what is the purpose of the feelings thermometer activity? You might check in the book. I've also described some things. How does this, you might just contemplate how this might assist the client-parent relationship, and how does this benefit the client-counselor alliance? You know, you'll also want the parent to start thinking about using that emotional monitor, that feelings thermometer, to help them deal with emotionally labile situations. How does this assist in the trauma and narrative sessions? How might this be useful for children in other aspects of their lives? So again, you're welcome to brainstorm there. Please describe the feelings you experienced while reading through pages 1 through 11 of the Cohen, Monterino, Clytherms, and Murray. What is your assessment regarding the benefit of these activities in the recovery of trauma? You do have a choice here, but I'd really, really encourage you, if you're going to understand what we're talking about this week and next, to read through pages 1 through 11. It's going to be very beneficial for you. That's all I have. Hopefully this has been helpful to walk through the AC components of the TFCBT model. Please reach out if you have any questions. I look forward to reading your responses. And by the way, I'm working on grading, trying to get caught up now. See ya.